Yo, what up? This is JT, the director of COVID Conflict. My production company, Anecessarie Film, created a body of work that we hope will encourage thoughtful and civil dialogue with community leaders, scientists, and people of color in the medical community on COVID-19 and its impact on Black and brown communities. As a production company, we owe it to our participants of COVID Conflict, and most importantly, the community that we serve, that this body of work highlights the various perspectives on this hot topic.
I got vaccinated again because I felt pressured. I could have lost my job if I didn't get vaccinated. So it's hard. There's a lot of people, who don't feel comfortable, and I think that's okay. Because, like I said, there's mixed information out there.
It's ugly, to see that people have to be pressured to take a vaccine. Got to remember, it's your body, right? So whatever outcome that comes from this vaccine, you have to live with it, not the person that's pressuring you into it. And if a company is pressuring you into taking a vaccine, you shouldn't be working with that company.
Even if the jobs who's mandating it, if everybody who didn't want it actually came together and actually walked off, you will crush that business. Nobody starts business to lose money. Everybody go into business to make money. You'll crush hospitals. You'll crush that business because they can't function if they don't have employees to run it.
Well, President Biden today hosted CEOs and business leaders at the White House to continue his push for vaccine mandates.
I'm announcing that the Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated.
On Capitol Hill overnight, a symbolic blow to President Biden's vaccine mandate for private companies. The requirements for companies with 100-plus employees already facing opposition on the courts, now rejected by the Senate, though the vote not expected to go to the House.
A South Georgia judge has made a decision that's having an impact around the country. Hours ago, the judge blocked President Biden's vaccine mandate for employees of the federal government who are contractors.
Houston Methodist saw more than 100 workers resign following its mandate this summer.
It's unconstitutional what the Biden administration was attempting to do. It's clearly unconstitutional. There has never been a federal vaccine mandate. States can do it. The federal government has no authority under the Constitution, and we've demonstrated that now 3 times and have won those 3 times. No federal vaccine mandates from the Biden administration in South Carolina right now as we speak.
The whole entire idea of New York City having a vaccination passport, now we're doing medical segregation.
I mean, a lot of people brag about having a vaccine. There's other people that get really scared about it, but I feel like that's what they want, to separate the people. Peer pressure, everyone gets it. So whoever has it, they just tell other people, yeah, I got it. So other people see that, and they want to get the vaccine just because other people get it.
It's difficult because, like I said, there's not a lot of information out there. So for you to, pressure a person to feel, how you feel, whether it be to get vaccinated or to not get vaccinated, it's not right because you yourself don't have complete information. So how are you going to pressure somebody else to follow your own beliefs?
The fact that no one posts their medical history or when they go take a medical checkup, and now it becomes like a badge of honor whenever you take the vaccine, you post it and you like looking down on other people and saying that, well, something is wrong with you of not taking it. It's very, very ugly to see that this is the way we're going about things. People are forgetting that these are personal decisions.
You know, I'm still uncertain about a lot of things, and that's okay. You know, if I'm gonna be demonized for having more questions and taking my time to make a decision with my life, then that's just what it is. You know, like that's something I gotta sit in. You know, I know the consequences of the decisions I make with my life. You know, I'm not here to sugarcoat any of that.
There's been a lot of, if I'm being quite honest, medical violence that has occurred in our community. So how dare any of us just try to make anyone else feel bad about what they do in terms of medicine and in terms of their body. We gotta be a little more understanding, and we gotta be a little more critical in our thinking.
Gotta go vaccinate, Chad, get it straight, Chad. Girl, you look good, want you vax that thing up. You's a handsome young brother, want you vax that thing up.
Yale posted it out in July of last year, and they wanted to get in people's minds. You know, let's look at the psychosocial behaviors. What messaging do we need to put out to make people say yes to this shot? And everything that Yale came back and said for them to do is what they've been doing. This is for us. This is so we can get back to normal. You know, this is so I can go see my grandma and, you know, I won't hurt anybody. This is the moral thing to do. I mean, that's all the message to get in people's psyche.
With COVID nearly 3 times more deadly in Black and Latino communities, leading African-American medical professionals also speaking up.
We are urging our community to take safe and effective vaccines once available.
The 2 target populations that they wanted to get it first was the elderly and the African-American communities. And that right there, of course, would raise an eye to me, because when I'm looking at the CDC data, at the particular times that I looked at it throughout this whole course of this pandemic, it wasn't how they was like it hit Black communities harder than others. I can't say that, because I'm looking at how it's targeting the white communities. You know, white communities is getting hit hard, you know, and if you look at correlation to the percentage of population of whites in America versus the percentage of population of Blacks, it was all about the same. You had over 60% targeting hitting white people. And then you had like 15, 16% hitting Black people. That's about equal to where we stand in regards to our population. So I don't see it as a Black issue, you know, where you got to target our community so hard.
It seems to me as though they're putting more effort in selling the rhetoric of the vaccine to minorities than they do with other things that we really need.
One thing that I'll touch on, and I hear this a lot, folks say, you know, and I think Charlemagne, the guy from the Breakfast Club, he talked about it. He said, you know, one of the reasons why he himself is skeptical, he said, you know, they are pushing this in our communities.
I've had people from the Biden administration, I've had people from, you know, Governor Cuomo's team reach out to me and ask me to be on these task force to help lead people to get the vaccine, lead Black people to get the vaccine. And I always say, man, I've never seen y'all in a rush to remedy anything else in the Black community. You know, when it comes to poverty, when it comes to police brutality, when it comes to all of these things that we know the Black community could use in order to thrive, I don't ever see y'all in a rush with anything to remedy those issues. But with this vaccine, it's just like, we gotta get it to Black people, and we gotta get it to Black people now. It's just like, nah, we got hundreds and hundreds of years of why we should not trust this government and all of these other things going on with us, and no help is coming, but this, you want us to just take? Nah, it's kind of,
Yeah, think about it. They doing $1 million raffles for somebody to get a shot. How about take that $1 million and clean up the crime off our inner city streets? How about take that $1 million and build schools where our kids don't have to go to school without heat in the winter? Put grocery stores in our inner cities instead of taking them all away and leaving us with these food deserts where people have to go to a corner liquor store to get food, you know, or go to that McDonald's or that Popeyes that's on the corner that they know is making people sick.
And so one of the things that I hear a lot at my institution is the language around why we need to get this out into the community. And what they're not talking about is it's capitalism.
I think the incentives are bullshit. What are you talking about? Vaccinate the Nation is kicking into high gear. Nearly 60% of Americans have gotten at least one dose. Now states and companies are going all out, providing incentives to those who have not been vaccinated.
I don't think I can overstate how excited we are right now.
Krispy Kreme announcing this week a free donut
every day this year for anyone who could show their COVID vaccination card.
Pot is legal in Michigan, and yes, it's free. It's one joint. Oh, but they call it a pre-roll if you get a COVID vaccine.
New York raffling off 50 full college scholarships in New York for kids who get vaccinated ages 12 to 17.
CVS Health launching a new sweepstakes. Thousands of prizes available, like a trip to the Super Bowl for two with game tickets, airfare, and hotel included. A VIP package to the iHeart Music Festival, a one-week Norwegian cruise, or 4-day trip to Bermuda.
Anheuser-Busch not being done either.
Anheuser-Busch announced that beer is on them on July the 4th. That's right, get a shot and have a beer.
Some people love hamburgers, some don't. Really want to respect all ways of life. But if this is appealing to you, just think of this when you think of vaccination.
You know they pushing the vaccine on us. Like, that's their main objective right now, is to push the vaccine, get everybody vaccinated. That's why they giving out all type of presents or whatever they trying to get to get people to do the vaccine. They just, it's a lot going on.
Giving people $100, if they go and get this shot. Like, when have we ever seen this? And then for the Black community, when have they ever cared about us?
One state was like, yeah, you'll be put into $1 million lottery. Another state is like, yeah, you get free French fries and all the rest of this bullshit. I think it's nonsense in regards to the incentives. It's a garbage across the board.
They're giving us, as clinicians, financial incentives to vaccinate our patients. One of them even offered, I think it was $750 per patient that we gave a shot to in our office. Then you got other insurances, that threaten to cut back, how much they reimburse you if you, don't increase your vaccination rates in the office. So you got all that tied to it. And then other people who are employed, by hospitals or other systems or whatever, if they speak out against it, then they get threatened of losing their jobs. They even said, to go to the leaders of the African American communities. If you want African Americans, you gotta go to the people that they trust. Go to their leaders.
I felt very comfortable, not only getting the vaccine myself, making sure Michelle got the vaccine.
Well, when Dr. Del Rio and Kimberly, but Dr. Manning, when they called up and asked if I would take it to encourage the community, I thought, I will do that, but you've got to answer all my questions. And I thought, well, while you answer my questions, why don't we record it so you can answer questions for a lot of people in the community.
And I'm working with trusted influencers, Steve Harvey, faith leaders like T.D. Jakes.
So now you see these churches trying to push it. Churches who's not even open for service, it's open for vaccine clinic.
More than 750 people, all members of the Black community, are going to get vaccinated at the clinic here at the oldest and largest Black church here in Aurora. And this is an effort that's been going on, put together by a group, Black Vax Aurora. It's a coalition of Black churches and organizations who want to ensure that there's equal access of the vaccine to the Black community here in Aurora.
As of Sunday, the state reported 1.6 million vaccinations, and data shows Black Americans across the U.S. lag behind whites in getting the shots.
The Associated Press looked at 17 states, including Florida, and found Black people are getting vaccinated at levels below their share of the general population.
Now we're talking two things happening. The media using vaccine hesitancy, which is very real and a sensitive subject, using that as an excuse for the blunders of the misallocation of vaccines for Black and brown people who actually want to get vaccinated.
The vaccine is not available at many community centers where minorities usually get their primary care.
And you have to know the location. You may not have transportation. There's a lot of barrier. It's not that simple.
There's a reason why they're not being vaccinated. They don't want to. Where we see the line wrapped around the block. We see servers breaking because people are trying to sign up and schedule. And so one of the things that I saw early on at my institution was it was overwhelmingly just all white people. My hospital's in East Harlem. It's in East Harlem. And I'm like, what is going on? And then only in the hospital entryway do you see the website to sign up. You don't see it at the coffee shops. You don't see it at the bodegas. You don't see it at the grocery store because I live in the community. You don't see it anywhere. So then I started sending a link out. I'm like, look, I don't care. Just click on the link and schedule because they have spaces. They have vaccines. I know that. And I sent it out to people and all of a sudden it just started getting shut down. They were like, we don't know. For whatever reason, they wouldn't let us follow through and schedule. I'm like, what is going on here? And so then they opened it up for 1 week and then they closed everything. They said, oh, the supply or the demand just outstripped the supply.
These programs that they have where you go in and take a test and you get a stipend. By the time we hear about it in the hood, it's just about going. Like they had a study going on here at Lennoxville Hospital. We didn't hear about it until it was right at the end. $225 in the beginning and a couple of $100 every week afterwards until it reached $800 when the project was complete. But by the time the news hit this part of Harlem, it didn't exist no more. So that was for certain sections around 96th Street near Central Park. That wasn't for us.
There's a disparity here. And at I think it was the Icon Stadium, they released some numbers and they said that only about 30% of those vaccines that they've been giving out have been gone to native New Yorkers. Wow. Otherwise, people from Connecticut, Jersey have been taking those shots. And so that's kind of what my experience has been looking at the disparity from that component.
Tonight, the vaccine battle reaching a fever pitch in the nation's capital.
If there is risk, there must be choice.
Thousands rallying on the National Mall for the Defeat the Mandates protest, featuring some of the nation's most prominent anti-vaxxers.
Some of the highest rates of vaccine hesitance are found among young Republican men and among Black Americans. 16% say they definitely don't want this shot. 11% say they are still taking that wait-and-see approach.
I understand the hesitancy within the Black community, completely understand it. But at the same time, I don't want my people to die. And we're almost on the trajectory as if you don't take it, you increase your chances of hospitalization, you increase your chances of death. And I'm trying to have a hot girl summer. So I tell people all the time, I got my vaccination. I'm trying to travel. What's up? What's good? But really just having those conversations with my family members and letting them know that, it is safe. It wouldn't have gotten as far if it was safe. I've worked with the FDA when I was at the biomedical device company, strict as hell. So nothing really would reach this level or be safe for human beings, if it didn't pass all of these tests. So yes, talking about the rapidness of how it got to market, talking about the misinformation and maybe some of the conspiracy theories. I've had the whole conversation. And at the end, it's really not about me convincing people to take the vaccine. It's just more about providing more information as much as I can in any way. If you don't want to take it, that's a personal choice. But again, I'm trying to travel. I'm trying to see my family. I'm trying to do all these things, and that requires a vaccination.
There's not enough data and research has been done on this specific vaccine. We understand that all resources were put in place to get this vaccine out, right? But it's just the vaccine, right? They don't know some of the side effects that the vaccine comes with. And that's the most critical part, the unknown.
I haven't got vaccinated yet. Everyone else, I think, my man got vaccinated, but not me. I mean, I'm not, huh? Why you haven't taken it? I just never had the time to do it, and I'm not really scared about it because I was working during COVID the whole time. So I figured I probably got COVID at least once. And I'm still alive, so as long as my immune system can fight it, then I'm good.
I believe everybody should get it. We have more freedom now since we have it. I can be around my family. My nieces are here visiting me, my nephew are visiting me. Now we can have a picnic and cook out and have a good time.
I mean, at this point, I haven't taken the vaccine. I haven't signed up for it. It's not mandatory at my job, and so I don't take medications anyway, right? So my thing is that the way I heal myself is that I look at herbal remedies, and I always tell my children, my food is my medicine. Vaccines have not been something that have been central to our health foundation in our family, and so we continue that. And when they become adults, if they decide to do something different, that we support them in their process, but we also continue to push and give them the information so that they make wise decisions. We have the benefit of lots of education and self-training, and we have the responsibility of using that and sharing that with our children. and that's what we do. And so if they decided if they thought now they wanted to do it, probably not.
I had all my childhood shots. My kids had all their childhood shots or whatever. But I am anti-lie. I am anti something that could be detrimental to people. I am anti that.
Now, if you or a loved one are thinking about getting vaccinated, the CDC has new guidance on how long to wait between doses. It says most people 12 and older should wait up to 8 weeks between doses instead of 3 to 4 weeks. This is for mRNA vaccines like Pfizer and Moderna. Studies have shown that waiting longer might reduce the risk of heart inflammation called myocarditis. That's especially for males between 12 and 39.
I'm anti trying to push people to be a part of an experiment, and especially trying to mandate people taking something experimental in their bodies to know that there's other options out here.
Tamika Morrow is an internist primary care doctor in Bloomfield Hills, Michigan. She has 13 years of experience as a nurse practitioner. She specializes in internal medicine and adult health. And as the CEO of Synergy, she influences healthcare disparities by leveraging holistic alternatives. Tamika has reservations about the COVID vaccine rollout. Throughout this documentary, she expressed her views and her beliefs, which are in the minority in the medical community and socially.
And so that's when I found this study about hydroxychloroquine. When I found that study, it was studied back because SARS-CoV-1 came back in the early 2000s. It was out back then. And the study said that the hydroxychloroquine worked to not only prevent SARS-CoV, but also to treat it if given early. So that was the key. It had to be given like within this window of, the first 3 to 5 days.
The hydroxychloroquine, coupled with the zinc and perhaps the zithromycin. But many doctors think it's extremely good, and some people don't. Some people, I think it's become very political. I happen to believe in it. I would take it. As you know, I took it for a 14-day period, and I'm here.
So I was like, excellent. I started prescribing that to patients. Now I'm feeling empowered because as a clinician, when your patients that you done built this bond and relationship with for years, and they come to you and they're scared, because at first we didn't know what was going on even in the medical community. And and it's like to tell them, there's nothing I can do, go home, turn blue, go to the ER. Like that was crazy. So next thing we know, we get these little love notes from our state licensing department from the state of Michigan. And it threatened our licenses if we prescribe that medication for patients. And I'm like, really? Like we're in the middle of a pandemic and here's something that's been studied that's effective and it works, and you're gonna threaten my license if I prescribe it? But I didn't care because I care more about my patients than anything else. So I was still doing it. So then we got another letter said that they empowered the pharmacists not to fill our prescriptions. And if the pharmacists filled the prescription, then they were going to take administrative action against the pharmacist's license.
Poison control centers are reporting that their calls are spiking in places like Mississippi and Oklahoma because some Americans are trying to use an anti-parasite horse drug called ivermectin to treat coronavirus, to prevent contracting coronavirus. What would you tell someone who is considering taking that drug?
Don't do it. There's no evidence whatsoever that works, and it could potentially have toxicity, as you've just mentioned, with people who have gone to poison control centers because they've taken the drug at a ridiculous dose and wind up getting sick. There's no clinical evidence that indicates that this works.
Ivermectin is, again, an old drug, been around for decades. It was on the World Health Organization list of one of the safest medications in the world. Not only was it safe, but it was also very effective. How excellent it was in preventing COVID as well as treating it. And it did show to decrease mortality by over 56%.
On the COVID front tonight, there's a new study out about ivermectin, and it shows the drug did not prevent COVID hospitalizations. As you remember, the drug gained popularity as an alternative therapy for those who caught COVID. Well, this study is the largest to date. It is published in the New England Journal of Medicine. Ivermectin is an anti-parasitic drug. 1,300 patients were involved in the study. Some took ivermectin, others got placebos. Researchers found that it did not help people recover any faster from COVID, and it did not reduce the risk of death.
Tamika shares several ways to treat COVID-19 for those who don't desire to get vaccinated.
So from a holistic standpoint, optimizing your vitamin D, We all need it. If you can get a liquid form, that'd be better because, like I said, if you take a pill form, you'll be lucky to get 50% of that. You want to make sure you take it with meals. It's one of those fat soluble where you need it with some fat, in the meal. So that's one thing. Another thing that they found, they did some studies on a few different supplements. One is called quercetin. Quercetin is an antioxidant. It's also an antiviral. It's also anti-inflammatory. So they noticed if you take quercetin with vitamin C, you can do that preventively. So it's a certain dose you can take to prevent, you from getting COVID, and then a certain dose you take to treat COVID. So that was something else that had some good studies about. They even did some studies about black seed oil that I found, black seed oil and zinc together, and how that had anti-inflammatory and antiviral properties that also helped give people protection against COVID.
Prior to me taking the vaccine, I came down with the COVID virus. But I did a home remedy for my aunt who was in the South, and I was better in less than a week. Something simple. Ginger, beets, garlic, red onions, vitamin C, vitamin D. 3 times a day for 7 days. In a 9-day period, I was able to get out of bed, go in the shower. I wasn't able yet to really take care of myself the way I should. But a few days after that, my strength started to return. All of my friends that went to Metropolitan Hospital, none of them came out. None of them came out.
Many of my friends and loved ones, they come from all different backgrounds: West Africa, the Caribbean, New Orleans, the other places in the South. And they have stories. They know how they grew up. They know how their grandmother healed when she was sick, or how they were healed when they were sick. It's indisputable. And yet, because we're in a system that, mainly runs on a Western medical philosophy, that kind of gets like subdued. Like, well, I don't know, because let me go to the doctor and see if they can prescribe. But so I look forward in a future where things are a little more integrated in terms of medical approaches. But for me, it's all about, again, empowerment, especially when we talk about our people. We have to know that we know. We have to be comfortable with what we know and be okay with saying, well, this works for me. So that's okay if that works for you, but this works for me. And I think that's going to be transformative.
We asked Tamika Morrow if under any circumstances would she recommend anyone getting the mRNA vaccines, and her response was pretty clear.
Absolutely not. Not at all. Not at all. Like I said, we know a lot more now about what to do about the virus, not about that vaccine, but we know a lot more of what we need to do to take care of people. And like I said, praise God, I have a 100% success rate. Every patient that I treated around the state of Michigan for COVID, like I said, some were in their 90s, some were fragile, some were the morbidly obese, the high-risk people that they talk about, some had cancer already, 100% success rate. Nobody had to go to the hospital. Nobody died. They started feeling better within 24, 48 hours of the medication, and everybody's been living, and they're not having any residual issues afterwards. So when you have something like that, that's available, that's safe, then there's no need for anything experimental where you don't know what it's going to do to your body, whether in the short term or the long term. Right. It doesn't make sense. I would rather go for something that's been around for a very long time, that we do know longitudinally, how it's impacted people, than to go over something over the short term. They even, I was even reading something recently that said that more people have died from these COVID vaccines in this last, 7 months since it's been out, than the number of people for all vaccines total over the last 20 to 30 years. I mean, that is just unbelievable. So you're really going to risk that for a virus that you have a 99% chance or more to get over? And now we know more about it. We know how to treat it. We know the course of the virus and what it does and how we intervene at each area. It really, truly doesn't make sense. If we think about how God designed our bodies, majority of us don't even produce the enzyme necessary, after the age of 5 to even digest dairy and to break it down. And so obviously he never created us to have dairy in our bodies after we were supposed to be weaned from our mother's breast. And so it's but with dairy, what I've noticed is highly inflammatory. It also increases your mucus production. So the more mucus you have, the more you can trap those virus particles and get sick. So staying away from dairy, staying hydrated, exercise. They notice that people who have a regular exercise regimen, It also serves that if they did get it, it minimized the side effects or how severe the symptoms were. So those are some things that we could do, to live, and make us have better outcomes.
I've decided that I won't share my vaccination status just because I've never shared any of my medical history status with anyone. So even just being asked that question in today's, I understand we're going through something we've never gone through before, not in my lifetime. And so that changes things a bit, but I've never shared my medical history with anyone. So it's just something that I won't do.
When I was about to take the vaccine, and I was told that, hey, this isn't totally approved by the FDA. That was kind of like, do I take this vaccine? And that was the last minute moment, but I ended up going through. But it got me thinking, like, hey, it's not totally approved of taking something that hasn't been long-term tested. However, because I'm from a scientific background and I've seen the power of science to transform lives, so I trust science when it's done right and for the right purposes. Even though there's some hesitancy, I think it's important that we have to protect ourselves as a community, and the vaccine offers that to a certain extent.
It's not about either side of the argument. You are scientific, and one of the main underlying foundations of science is asking questions. It's okay to do that. It's okay to do multiple trials of something, whether it be in your mind or in real life. It's okay to collect data over time. That's what a true scientist is and what a true scientist does. So, don't feel any way on either side about making the decision that you made. Make an informed decision as much as possible and just be well. Take care of one another. We can't be divided right now or at all, to be honest. We cannot be divided.
It absolutely is something that we all should consider. Not to say everyone should take it, but to consider it as, okay, that's another tool in this toolkit. And so that's kind of, I don't tell people yes or no. For me, full disclosure, I have taken it. I've received both of my doses of Pfizer. And I can share with you kind of what went into that calculation, because it wasn't all at once. In fact, when I went in there to get the vaccine, I was like, wait, let me think about it. I actually told the nurse before, she's like, all right, which arm? I was like, hold on, let me think about it. And here I am armed with all of this knowledge. I've been in school for 15 years and understand intimately what the vaccine does and the mRNA technology and all of that. And so I still felt that, and it was really coming from that deeper place of mistrust. And so I think that, for me, that's where I am with it.
Again, everyone, we made this film at a time when there were so many questions, concerns, and uncertainty with COVID-19 and the distribution of vaccines. The objective was never persuade the audience on a personal decision. We wanted to gather information for those of our community so our audience can think critically beyond just a personal decision and spark awareness. Thank you. Peace.